if you're struggling with that pain, like right in your butt, it sometimes feels like your leg is gonna give out a little bit. The pain sometimes can travel down your leg or just right there, but it's so painful, uncomfortable, especially sitting or laying down. This video is gonna be for you. We're gonna go through a quick routine so that way you can feel relief whether you're pregnant or postpartum. So you can be able to move and enjoy this experience instead of barely surviving it. So the first thing we're gonna do is we're going to do hip internal rotation. So knees are gonna be underneath your hips, hands and knees, and all you're doing is tapping your feet out to the side. Just nice and gentle. So we're gonna go ahead and get started. Ready? And tap to the side, tap out to the side. So what this looks like is hands and knees tapping out to the side. Nice and easy. You might feel something up in your hips, you might not, but we're just gently gonna tap out to the side. If you wanna make it a little more challenging, you can add a loop around your feet as you do this, but gentle pulling, tapping to the side. We're trying to let those glutes relax, and this motion is the opposite of what your glutes are responsible for. So it helps relax the glutes so that way you have less pain and tightness right in that area. Okay, this next one's gonna maybe be a little weird, especially if you aren't someone who enjoys lifting or working out in that nature. We're gonna do just hip hinges. If you've done a deadlift, you probably know how to do this. But you're gonna have soft knees and you're gonna hinge at your waist. Make sure the weight is through your heels and breathe out as you stand up. Okay, we're gonna do it together. You're gonna hinge at your waist, your butt goes back, so the weight is through your heels. You're gonna feel like a stretch through your butt and your hamstrings, and then breathe out and stand up. Okay, if you're having pain in your back, you really have to breathe out and tighten that core. If you're pregnant, hug that baby, breathe out and pull up. Okay, we want to make sure we're lengthening this area here and teaching those glutes how to work the right way. Breathe out and stand on up. Okay, nice and simple, bending forward. Breathe out, stand up. So tightening that core as you breathe out. Last one, and come on up. Next one is going to be a modified pigeon. What you're gonna do is the leg's gonna cross in front of you. It's just like a pigeon on the floor, but you can use a bar stool, edge of a couch, armchair, armrest. Sometimes the bed is a good height. If your belly's in the way, you can bend the knee, but you're gonna lean forward a little bit and get a stretch right through your glute there, okay? This is kind of how I like to do it. If you have a desk, you can do it on your desk, but getting that glute to relax here so that way you can move with having less pain. We'll eventually switch and do the other side, and I want you to feel the difference between one side to the other, okay? Try to focus on breathing, really allowing your belly to expand to allow your body to relax, okay? Just nice, simple stretch here. When you do this on your own, you want to do it for about 30 to 60 seconds. This is a great stretch to do if you sit all the time or if you're on your feet all the time. It's just a great way to kind of break up your day and your movement. Okay, so now you're gonna switch and you're gonna do the other side. Putting the other leg up, getting yourself ready. Take note of how it feels, even just getting your leg up there. If you don't feel a stretch with the knee, you can put the whole leg on and get a stretch through there. For me, that's a bit intense, so I like to just do the knee. But doing what stretch feels good, okay? We're not pushing through pain. I hear all the time, like in the clinic, no pain, no gain, and that's only true for certain things. This pregnancy pain is not true. We are not just pushing through the pain. If it's painful, we need to find a different way to do something or just change how you do it, modify, okay? It's not a big deal if we have to modify something. Sometimes it feels very defeating if you can't do the things that you are used to doing. But we have to listen to our body in the terms of we're not pushing through pain. A lot of times we tell you to listen to your body, but we've also been telling you that pain's normal and you just gotta get through it. So you think that it's okay to continue to go as you're still having that pain and discomfort. I don't want you to do that, okay? How was that stretch? How did that feel? This is just a quick 4-minute thing that you can do, but here's the deal. Your pain that you have during pregnancy, exercises are great, but they're not everything. They're almost like a Band-Aid. We have to find the cause of the pain, and we have to fix that first. This is why I created the BSR method, which is basics of your pelvic floor, so that way you can support your pelvis throughout your daily activity with everything you're doing. It might hurt to roll over or get dressed or stand up or walk or lift something or bend over. And when we do those things, you want to be able to do them without pain, and we want to be able to do them in a way that supports your body. Then we can add in restoring stability and balance and strength like that through exercises like this. So if this feels good, but then you're still having a lot of pain and discomfort, the BSR method is located in the pain-free pregnancy and postpartum package. This is for pregnancy and postpartum mamas. If you are struggling, don't just push through it. There is help and support for you, even if you feel like you have tried all of the things. Tylenol, heat, belly bands, and sometimes the stretches and exercises just aren't exactly what you need. You need to learn the basics to be able to support your body, and then we can add in those exercises and stretches. I want you to be able to feel good throughout your entire journey and experience. Your body's with you forever. It's not just creating babies. It's not just postpartum. We want to grow old and feel strong and be able to play with our kids and maybe grandkids or whatever our life has at the end. And so often our birth experiences and our pregnancy and postpartum, they affect how we feel long term. And you deserve to feel good and strong and comfortable in your body. So I'm sending you love. There's links down below if you want more help or information, support, anything like that. But you've got this. I'm sending you love. I hope this helped you.